especially in their middle years, face particular challenges regarding their heart health. These include atherosclerosis or clogged arteries and the effects of menopause. Our guest today, Dr. Ritu Thaman, understands and responds to these challenges every day. She's a respected cardiologist and researcher who focuses on cardiovascular disease in women. Dr. Thaman, thank you for being on House Calls.
Wonderful to be here.
Well, let's pick a number and get started. What should a woman who just turned 50 be thinking about when it comes to her heart health?
Well, it's an interesting question. Since cardiovascular disease is the number one cause of mortality for women, it should be on every woman's radar. And certainly as we enter middle age, late 40s, 50s, there are a lot of changes that are occurring physiologically, one being menopause. But in addition, the United States does not have a screening that is just for cardiovascular disease in women. We have it for other diseases, like certain types of cancers, but we don't have one specifically for women for cardiovascular disease. And so these are things that you must be aware and advocate for yourself when you do go see your doctor.
Let's get specific about preventive measures women should be taking.
It's essential to start with Life's Essential 8 as proposed by the American Heart Association. All of these factors will come into play. Also, your prior history. You need to know what your pregnancies were like. Did you have preeclampsia? Did you have gestational diabetes? All those things put you at higher risk of developing atherosclerosis down the road. You should also know your numbers. You should know what your blood pressure is, what is your cholesterol level, what's your BMI, what's your weight. And you should also know, am I really getting the physical activity that I should as recommended by the AHA, which is 150 minutes per week? And the majority of women in this country do not get that. So those are the important considerations to have in focus as you go through these sort of middle years.
Would you discuss the menopausal years and cardiovascular triggers?
Well, as you know, the hormones are at the central question. So as the level of the hormones go down, that influences the whole endocrine system, which is your whole body. So levels of cholesterol can change. The way your blood vessels react changes. The type of plaque that forms in women happens over time, and it's a gradual process. There's more of a diffuse pattern of disease, what we call microvascular disease. Men have thick plaques and cause obstruction. We, women, do not have that. So we know that these hormones are protecting us, and that's why we sometimes see a delay in this atherosclerotic process in women versus men. Most of the stress tests were designed with the idea that we're looking for this obstruction. You need to know that there could be a difference and that you want to have something that's going to be very specific for what, as a woman, you need.
Dr. Thaman, thank you so much. It's been great to hear from you today. You've given us a lot to consider about women and their heart health. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.